Welcome to Healthcare Reform Demystified. Today's episode, Grandfathered Plans and the Affordable Care Act. The Health Care Reform Law includes significant changes to the way Americans get health coverage. But at the same time, many of the 133 million Americans with employer-sponsored health insurance will maintain the same or mostly similar coverage they have today because of a provision called grandfathering. If you have a plan that existed on March 23, 2010, and that has covered at least one person continuously since that time, your plan may be a grandfathered plan. To help you understand which rules apply to grandfathered plans and how they might affect your coverage, let's go to a quick true-false quiz. Okay, here's our first question. Grandfathered plans are exempt from all provisions of the health reform law. True or false? False. Even grandfathered plans must follow certain requirements of the reform law. For example, if dependent coverage is offered, they must offer coverage of adult children up to the age of 26. Although until 2014, grandfathered plans may exclude adult children who are eligible for other group health coverage through their employer. Grandfathered plans cannot exclude enrollees who are under the age of 19 because of pre-existing conditions, and they cannot place lifetime dollar limits on services deemed essential health benefits. Let's try another one. Grandfathered plans must cover preventive care services without cost sharing. True or false? False. Under the health reform law, grandfathered plans are not required to comply with the preventive care mandates and can keep the same preventive benefits that were in place on March 23, 2010. With me so far? Okay, let's try one more. If a grandfathered plan makes any changes to its coverage or requirements, it will lose grandfathered status. True or false? False. Grandfathered plans are allowed to make certain changes and add new members without losing their status. Generally speaking, the kinds of changes that would cause a plan to lose grandfathered status include the elimination of certain benefits, increasing member coinsurance by any percentage amount, and increasing copays, deductibles, and out-of-pocket limits beyond allowed amounts. Also, if the plan sponsor decreases its contributions toward the cost of coverage by more than 5%, grandfathered status would be lost. All of these changes are measured against the benefits that were in place on March 23, 2010, in considering if grandfathered status is kept or lost. Also, grandfathered plans are free to increase their benefits without risking their status. There's a lot more to grandfathering than what we've covered here today. But the bottom line is that being a member of a grandfathered plan means that some of the provisions of the health reform law may not apply to you. If anything, you may see new benefits, and that's a change for the better. You can find more answers to questions about the Affordable Care Act on the United for Reform website. And as always, contact your broker or a United Healthcare representative with any questions about your plan. That looks so much better. So, you're a grandfather. What was it like before healthcare?